Hi, I'm Dr. Kaycie Griegel, and I'm here to talk to you today about hormone health for breast cancer patients and survivors. I just want to give you a little bit of an intro into what happens to your hormones while you're going through treatment and how your hormones are going to be impacted. All right. So first of all, I always like to tell people, talk with your team. Anything that you decide to do to impact your health that you undergo during your cancer therapy, just let them know what's going on so they can give you your 2 cents about making sure that what you're doing is right for you. So I am Dr. Kaycie Griegel. I'm a naturopathic doctor. I've been in practice for 20 years, and I have a focus on women's hormone health. And I'm also a breast cancer survivor. So anything that you've been experiencing is something that I understand. I've gone through it myself. So let's talk about breast cancer and estrogen. So if you have breast cancer, your treatment is likely to impact your hormones. And now around 80% of breast cancers are estrogen receptor positive, and about 65% are estrogen and progesterone positive. And so for women with a cancer that has not spread, that 5-year survival rate is over 98%, which is awesome. And still over 90% even for cancers that have already spread with these estrogen and progesterone positive cancers. And what does that mean? It means that those cells in the breast cancer actually are activated to grow by estrogen. So your treatment plan will likely include something that decreases your estrogen levels on purpose. That's the point of what they're doing, so we can decrease any potential growth. Now, my goal and what I do in my practice is to help you thrive and feel really good and continue to be balanced through those changes that you might experience. So just to review, what does estrogen actually do in your body? And obviously, estrogen is related to your cycles. And some of my patients and students do still want to have babies after breast cancer treatment, but not everyone does. So we're not going to talk about that too in depth. We're going to talk about some of the other things that estrogen does. So first of all, estrogen is related to the health of your reproductive tract. So vaginal elasticity, the health of the vaginal area and lubrication is really important. And estrogen impacts your libido as well. So sexual health is important. And estrogen is also related to having your healthy cycles, as you know. Second of all, we have bone health. And bone health is really critical, and it's something that I really like to focus on, making sure we keep bones healthy and prevent osteoporosis as breast cancer patients move through life. So it's really important because it helps to deliver calcium to the bones, and it improves the mineralization. So it helps keep your bones nice and dense. And then finally, estrogen helps with your overall vitality. It helps with your energy levels. It helps with emotional balance. And estrogen helps with your cardiovascular system by improving those good cholesterols. So how does treatment actually impact your estrogen levels? So as we mentioned, the goal of treatment of a hormone-positive tumor is to reduce your estrogen levels. So two of our primary sort of post-primary treatment medications are tamoxifen and some kind of an aromatase inhibitor like Arimidex or letrozole. Now, tamoxifen is what we call a selective estrogen receptor blocker. That is, it blocks estrogen from being used in the breast and the reproductive tract. Now, aromatase inhibitors are a little bit different because what they're doing is once you go through menopause, your ovaries don't function anymore. And so your ovaries, if they're not making estrogen, then estrogen comes sort of remotely from our adrenal glands. So our adrenal glands will make something called DHEA, which is a precursor to estrogen. And then it uses, as it circulates through your body, there is an enzyme called aromatase that converts DHEA into estrogen. So if you are using an aromatase inhibitor, that conversion from DHEA to estrogen is blocked. Now, the difference between those two is that tamoxifen, again, it's selective. It's just going to impact the breast and the reproductive tract, whereas the aromatase inhibitors are also are just going to make it basically so you don't have estrogen at all in the body. And that's important when you're considering bone health. I always just like women to know that, is that you're not going to be getting that estrogen stimulation to bring calcium to your bones. The other way that estrogen may be impacted by treatment is through chemotherapy. And even if you don't have an estrogen positive cancer, even if you have a HER2 positive or a triple negative cancer, if you go through chemotherapy, that also can damage the ovaries. So for instance, when I went through chemotherapy, I had one cycle and then I was done. And that's a pretty common thing for women to experience, is that the chemotherapy itself is going to damage the ovaries enough that you're just going to go straight through menopause very quickly. So sometimes it's not clear what symptoms you're having that may actually be impacted by your estrogen changes. And so I really like for women to understand that. So what symptoms are hormone related? Obviously, the hot flashes and the night sweats, those are kind of like the keynotes of estrogen change. But it's not everything that you may be experiencing. Although hot flashes and night sweats can range from sort of mildly annoying to really, really life impacting. So I do like to make sure that we get those managed. But you might also have emotional changes. A lot of women will have anxiety or insomnia or depression. And one of the things I see a lot is that sort of like repetitive thoughts, that hamster wheel brain, that things just sort of click, 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 click all the way through the night, or you're having these thoughts during the day that can make you feel more and more anxious. Heart palpitations can be significant. Your libido can change significantly, along with the decreased vaginal lubrication, so sexual health changes. And your digestion can even be impacted, and weight changes can happen as well. So when I talk to my patients and my students about their hormones, I always like to mention that I don't just look at one specific hormone as being the cause of your issues. Often our hormones all have to work together like in a symphony. We have to have that symphony that keeps everything really balanced. And so when we go through breast cancer treatment, our adrenals can be significantly impacted. That's where our stress hormones come from. And guess what? You probably know this. Breast cancer is really stressful. It's hard from a brain, like thinking about the stress. And then it's also hard on your body. It's a stress to the body. So the adrenals can really be impacted there. Additionally, if you go through chemotherapy, the dexamethasone that is given during chemo can really impact, because it's an analog to your cortisol levels. That dexamethasone can really mess with the way that your brain and your adrenals communicate and the way that your adrenals are producing those hormones. Your thyroid also can be impacted by breast cancer treatment. The stress also can make that thyroid, really have some changes. And then chemotherapy drugs in themselves can also have a negative impact on the thyroid. And then finally, just that brain center. The brain center is really like the conductor to that symphony. And so all of the stress and all of the changes that can happen to your nervous system really can impact your overall production of hormones. So the goals of holistic support, from where I really approach things, are basically three things. One, I want to manage your menopausal symptoms in a way that is safe and that is hormone free. We want your body to feel like it has enough of those hormones, even though we're keeping those hormone levels low. And everything that I use, I sort of exhaustively have researched to make sure that they are safe and hopefully also cancer preventative. Secondly, I like to make sure that your mood is good, because when you are feeling balanced from a mood perspective and you're sleeping enough, everything else is better. So when we can get you to sleep, we can get that brain to relax, then everything's going to feel a little better. And then finally, we want to retune that hormone symphony. And so we want to be able to support thyroid, reproductive, and adrenal hormones. So we kind of look at it as a whole package. I'm just going to give you a little taste of one of the things that I like to use in my practice. The plant black cohosh is something that can be really helpful for women that have gone through breast cancer treatment, because first of all, it's helpful for your symptoms. It improves hot flashes and night sweats. Also, some of the insomnia and the anxiety, and some of the studies are showing that in breast cancer survivors age 35 to 52, that is that perimenopausal, premenopausal time when you may have gone through menopause early. And it helps even among women who are concurrently taking tamoxifen. And then the added bonus is that it increases the survival time, both in women who do and do not take tamoxifen. So this is something that I use frequently. Obviously, you have to do whatever is useful for you as an individual. I'm always happy to talk about that. Please feel free to contact me. But this is just one of the little tools that I like to use. All right, thank you so much for your time. Thriving Survivors is where I am to help you with all of your breast cancer related concerns. My website is thriving-survivors.com, and you can check me out on Instagram and Facebook at Breast Thrivers.